Vascular disease is a disease process that can involve any artery in the body. In peripheral vascular disease, we're specifically talking about disease processes involving the arteries that go to the limbs, and particularly the legs. The process usually begins with risk factors. So when you have diabetes, you have high circulating glucose that's running throughout the arteries. And people who smoke, the products associated with the nicotine can cause inflammation in the arteries. Over time, that inflammation develops into a plaque. And if that plaque continues to grow, it can start to narrow blood flow in a certain vessel. And whenever blood flow gets compromised, for example, to a leg or limb, you start getting the symptoms of claudication, which is a sign of peripheral vascular disease. And that basically involves pain in the extremity, especially when you're trying to move around or ambulate. Patients typically, when they're walking, you start to notice that you get severe cramping or discomfort in the leg. That's a pretty specific sign for arterial disease or blockage in those arteries that are feeding the leg. For treating peripheral arterial disease, we have several percutaneous options where we insert a catheter. It's a minimally invasive type of surgery. There's no incision typically involved, and the recovery is usually fairly quickly. Usually by the end of the day, patients are able to get up and walk around and be discharged home.